Chair, I can confirm we're now live.
Great, thank you very much. Well, good afternoon, everybody, and I'd like to welcome everyone to this public virtual meeting of the Local Outbreak Engagement Board. Please note that this video is being broadcast and recorded. First item on the agenda, apologies for absence.
Chair, I've received apologies from Councillor Bettison, Councillor Birch and Acting Inspector Sophie Gardner. Of course, there are sometimes problems accessing digital meetings, so anybody who doesn't appear in the call will have their apologies recorded.
Brilliant, thank you. And Kelly, it looks like you're off the hook. I can see that Gabby has now joined the meeting. And so is Councillor Hayden. Right, moving on, can I just ask members of the board, I'll hand over to Kirsten just to do a roll call, just to make sure that everyone is here. And as she said, anyone that's meant to be here but can't get on will be recorded as having attended.
Thank you. If I could just call members' names, if you could just turn on your microphone and confirm that you're present. Councillor Dr. Barnard. I've received apologies from Councillors Bettison and Birch. Councillor Brunel Walker.
Here.
Andrew Hunter.
Present.
And Abby Thomas.
Present.
Kelly Williams.
Present.
Elena Rozelle.
Present.
Gabby Hafner.
Present.
Thank you, Gabby. I've got you, although you're breaking up a little bit, but I do have you recorded as present. I've received apologies from Acting Inspector Sophie Gardner. Fiona Slevin Brown. I can't see Fiona on the call, but I'll record her apologies. Philip Bell.
Present.
Thank you. Is there anybody else on the call whose name I have not called? I'll run through the list, and if you're on the call, if you could just turn your microphone on and confirm your presence, please. Tim Whedon, Stuart Lines, Sarah Bellas, Councillor Mrs. Hayes.
Present.
Councillor Harrison. Councillor Hayden.
Present.
Councillor Turrell. James Sunderland. Adam Afria. Jerry Barber. Mary Stamp. Is there anyone else present whose name I have not called? Thank you, Chair. That's a complete roll call.
Great, thank you very much. Moving on to item 2, does anybody have any declarations of interest? It's probably just me as the councillor on the panel. I have none. If anyone finds an interest and need to declare later on, usual rules apply. Item 3, are there any urgent items of business?
No, Chair, I'm not aware of any.
Brilliant. Item 4 is to review the current data that relates to levels of COVID-19 infection rate nationally and within the borough. Over to you, Gabby, if your connection is working. If not, Kelly.
I'm going to share my screen, Gabby. Okay, can you see that?
Indeed, I can.
Okay, Gabby, I'm going to assume that you're not able to hear or speak at the moment. So I'll start working my way through this presentation.
I'll have a go.
Oh, do you want to come in?
Just to
Go.
say, that's joined. Councillor Barnard's joined. Very, very dodgy connection today. Apologies.
Sorry, I do seem to have some.
Okay, I'm going to just start talking through the presentation.
I will.
Gabby's got a poor connection. So the first slide here to talk you through will be one that you're very familiar with. This is our rate per 100,000 of positive COVID cases within the borough as compared to our neighbours across the Berkshire area as well as the South East and England rates. So you can see that to date we've had a total of 12,398 confirmed cases, and over the last 7-day period that we have complete data for, we've had a total of 370 cases within the borough. That gives us a current rate per 100,000 of 298 cases per 100,000, which is an increase on our case rate last week of about 37%, and a further increase, although a small one, of just 3% on the week prior to that. So you can see that whilst our case rate is relatively high at 298 cases per 100,000, we are still marginally below the South East average at 305.5 cases, and below the England average of 339.6. In terms of our over 60 population, the population that are more vulnerable to becoming severely ill with COVID, although our case rate is rising within that population, it's considerably lower than the prevalence within the general population in the borough, with a case rate of 90, just over 90 cases per 100,000. We are seeing an increased testing rate and an increased positivity rate, which gives us an indication of how widely the transmission is occurring across the community. But you can see that nothing that is out of line with our counterparts in Berkshire, or indeed across the South East or England regions. We have a look at the situational awareness across time. So this chart here shows us the trend. This chart is for the whole of Berkshire, and you can see Berkshire is shown in the blue line, the South East in the orange, and England is represented by a grey line. Essentially, what you can see here is that in Berkshire, we are following the trend that both nationally across the England region and across the South East region. We did see a slight blip during August across Berkshire, although that wasn't one that was represented within Bracknell Forest. And if I show you the following slides, you can see the top left chart is Bracknell Forest, and we've remained very much in line with the South East and England averages. And you can see that it's only us and Slough that have done that. All of the other 4 Berkshire unitaries, Reading, West Berkshire, Windsor, Maidenhead and Wokingham, saw a spike in the August period, but we've remained in line with the regional average. So this chart here just gives a representation with the darker areas showing higher rates per 100,000. I mean, as you can see, the whole area, with the exception in Berkshire of West Berkshire, which is shown as area 4 here, is now in the darkest shade, which is over 250 cases per 100,000. One of the things that is changed quite significantly since we last met as a board is the breakdown of positive cases by age group. So the information you can see on the screen here covers the 14-day period from the 14th to the 27th of September across the whole of Berkshire, just shy of 5,000 cases. And you can see that the breakdown per borough shows the age groups. So roughly even split between male and female, so 54% male, 46% female. Majority of cases, 76%, from those with a white background and 24% from a BAME background. If you look at the age breakdown, you can see that across the whole of Berkshire, in every borough, with the exception of Slough, over 50% of positive cases were identified as being children and young people under the age of 18. So the 18 to 34-year-old age bracket, which you can see in orange on the chart here, has really been squeezed down. And you can see in one of the charts that you've got coming up just how how that spread breaks down and is reflective of what we're seeing in terms of high numbers of case rates amongst our school age population. This chart here just gives you the case rate per 100,000 by ward. Again, I think this isn't something that we need to be too concerned about. This fluctuates very, very frequently, and we do not currently have, and actually have never had, any particular ward or area of the borough where case rates are consistently higher than other areas. But we just report on this for completeness. And on the following slide, again, you can see the case rates here broken down by ward. So currently, we've got a higher number of cases in the last complete week of data within Harmonswater. But again, nothing really statistically significant about that or anything for us to be concerned about at the moment. So this next chart here just gives us a little bit more detail in terms of the breakdown of the ages of those people who are testing positive. So each of the rows represents a 5-year age band and enables us to see whether cases are getting higher or lower in each of those age bands as we progress through time. So the time scale along the bottom of the chart there takes us back, looking back over the last month or so, and the darker the colour, the higher the rate per 100,000. So the good news story that we can see from this chart is that in our older age groups where, as I've said earlier, the impact of COVID is more significant and concerning, you can see that the vaccination programme that we've rolled out locally continues to be highly effective, and case rates per 100,000 remain low in the older age groups. What this chart clearly shows us is that in school-age children, the case rate per 100,000 is incredibly high and is continuing to get higher and darker as time progresses. You can also see, if we look here at the 40 to 44 age bracket and the age bracket just above and below that, you can see that numbers there are also beginning to get higher, with the darker colours beginning to emerge, which the hypotheses behind that is that they're likely to be parents of school-age children who are testing positive, and then household transmission is occurring. Just to give you an indication of the actual case rate in the school-age population, the age group that we're seeing the highest case rate within is the 10 to 14-year-olds. And as of the most complete data that we had on the 28th of September, the case rate for that age band is 1,634 cases per 100,000. So as you can see, that's more than 4 times higher than the general case rate within the borough. If I move on to this slide now, which shows deaths, again, this covers the whole of Berkshire. It's not specific to Bracknell Forest. There have been a total of 197 COVID-related deaths during the pandemic, but we've had no COVID deaths recorded in the last week that we have data for, and that's the week ending the 10th of September. In terms of the all-cause mortality rate, it's slightly lower than we would expect for this time of the year, and that's represented by the grey line that you can see on the chart there in front of you. The next slide looks at hospital activity. So you can see that for both Frimley, for patients who are admitted to hospital with COVID across both sites for from the Frimley Trust, numbers do remain relatively low, particularly when you compare that to the spike that we saw this time a year or so ago. However, it is worth reflecting that there are still patients in hospital in our Frimley sites, both on the wards and in ICUs, and the hospitals themselves continue to face extreme levels of pressure, as does the primary care service locally, although both are very much open for business. This slide here looks at the COVID vaccination rates. The slide will be published and available for people to review the rates in detail. So I don't propose talking through any of this in any detail here, but some of the headlines that 84% of people in Berkshire aged 40 and over have now had both doses of the vaccine, and 76% of those who are aged 18 and over. And you can see that actually our vaccination rates in Bracknell Forest for both first and second doses continue to be very high and very much in line with, if not above, where we would expect them to be at this stage. Just a slide here talking through where we can, you can access further information on the data if you so require. The next slides that I've got are those that go on to talk about the policy changes since the last time we met. So Chair, I don't know if you'd like me to pause there and just check if there are any questions on the data before I proceed.
Thanks, Kelly. Does anyone have questions? I think Peter, I saw your put a hand up in the chat.
Thanks, Chair. It was just the very high rate for the, what was it, the 5 to 16? I can't remember how, I can't even, just
10 to 14.
the 10 to 14. How does that compare across the southeast and the rest of England? Because I assume it must be fairly uniform, but
It's entirely uniform. We're very much in line with what's being seen both locally and nationally. We're certainly not one of the highest areas. There are some areas with considerably higher case rates per 100,000 in that age group, but we are very representative of what's happening all around us.
thanks, Kelly.
Any other questions? No, brilliant. Okay, thank you very much. Kelly, anything else before we hand over to Elena?
Yeah, so I'll just go through some of the updates from the policy world before I hand over to Elena. So one thing that's a significant change since the board last met is the publication of the government's autumn and winter plan 2021. The plan is widely available online. So I just wanted to pull out some of the highlights to share with the board today. So really the key thing is there are 5 key pillars or strands to the autumn and winter plan, and our local response will be very much continue to be tailored to fit around the updated autumn and winter plan that the government have published. So the first one is around building our defences through pharmaceutical interventions. Obviously, there's lots of focus in the news and has been for some time around the vaccination programme. But those of you following the news will have seen more recently about the task force that are working hard to develop new antiviral medication and other pharmaceutical treatments to support those who are tested positive for COVID. So that work continues, and as a local authority, we continue to work closely with our colleagues in the CCG and the healthcare trusts to support the rollout of the vaccination programme. The next key theme within the plan is on identifying and isolating positive cases to limit transmission. So that's the test, trace and isolate system. So we have our own local contact tracing system, and we have staff who are working hard to reach out to anybody locally who does test positive to ensure that they're aware of the requirement to self-isolate, but also to make sure that if they do have any practical or emotional support needs during that period of self-isolation, then we're able to make sure that we support them with those. The third pillar to this plan is around supporting the NHS and social care. So I think everyone's been very aware throughout this pandemic of the pressure that colleagues in the NHS have been facing, but a recognition from this plan that those pressures are just as significant in terms of the social care system. So a real focus on ensuring that that those systems, both our healthcare and social care system, are able to manage the pressures and to move towards recovering services that have been reduced or suspended during the pandemic. The fourth pillar of this plan is around ensuring that people are aware how they can protect themselves. So a real movement away from legislation to prevent certain activities, and a shift towards people taking personal responsibility to do everything that they can to minimise the risk of them testing positive and transmitting the virus. And the next slide will show just some of those key points, which I'm sure people will be familiar with. And then the final pillar is around pursuing an international approach. So there's been some focus, particularly over the summer months, with a lot of focus on travel around managing risks at the border and variants of concern. But this fifth element to the plan now also looks at the arrangements for ensuring vaccination programmes across the world rather than focusing just on our own country. All of those 5 elements that I've outlined there form part of the government's Plan A, but there is recognition from government and from all of us working on the COVID response that there are a number of variables within the system which are going to be monitored closely. And it may be that the government need to enact their Plan B at some point during the winter months. and information about what that plan B looks like has already been published to ensure that both members of the public and businesses can know what to expect and be as prepared as possible. So this next slide here is just a visual representation of some of those key things that we're continuing to ask our local residents to continue doing so well as they have done throughout. So firstly, to make sure that as many people as possible get vaccinated, and that's fully vaccinated. So both first and second doses for those that are eligible for either an initial third dose of the vaccine or in fact the booster vaccine programme, to please ensure that you go forward and access your vaccine when you're able to. The importance of ventilation, letting fresh air in. As the weather gets colder, of course, there's more likelihood of people meeting indoors. So the importance of making sure that you still have doors and windows open to get fresh air. Continue to wear face coverings if you're in crowded or enclosed settings, particularly if you're mixing with people that you don't ordinarily mix with. The importance of getting tested. So that's regular testing using the rapid lateral flow tests to help with screening for asymptomatic cases, as well as ensuring if you have any symptoms at all that you book yourself a PCR test through the national booking system. If you're unwell, please stay at home by yourself, isolate until you feel better. And then finally, the importance of hand washing and downloading and using the COVID-19 app. So final slide from me, just highlighting some of the key policy changes in a little bit more detail. So the first is with regards to the asymptomatic testing programme. That testing programme was due to run until September, at which point the government conducted a review. And we have now had confirmation that asymptomatic, free asymptomatic testing will continue for all members of the public, and that will continue to be available through Pharmacy Collect, local collect sites such as One Lexicon, or ordering for home delivery on the gov.uk website. There is a move for those who are using Pharmacy Collect to go online and obtain a token beforehand, which will just give us a bit more information, be able to track a bit more easily who it is within our community that is testing regularly. For anybody who doesn't have online access, you can call 119 and they will be able to give you the token reference number in advance of going down to your local pharmacy. And finally, confirmation has been received that the asymptomatic testing programme in schools has been extended to the end of the year. So that's for staff and students in secondary schools and colleges, and for staff in early years and primary settings. In terms of travel, as from this week, just yesterday, the amber and green lists no longer exist. There is just a red list that remains in place, which has been reduced. There will be exemptions for those who are fully vaccinated to the day 2 testing upon return. For those that are fully vaccinated or under 18, we are anticipating that the requirement for a PCR test may change to an LFD test at the end of October. The government have confirmed that, although we've not yet been cited on any of the details of exactly when that will be introduced and whether or not that will be a home LFD test or whether or not you'll need to visit a site to have a supervised test. So we will clarify that as soon as we know. In terms of vaccination, the schools' immunisation teams have already got underway, doing a sterling job with delivering the COVID vaccination programme to 12 to 15-year-olds, all of whom are being offered a single dose of the vaccine. As I mentioned already, for those individuals who have had 6 months passed since their second dose of the vaccine, they're now eligible for a booster vaccination, and they will be either invited by text message to book an appointment, or if they are post 6 months from their second vaccine, they'll be able to book via the national booking system. And that does also provide access to our local site in Waitrose, which does appear on the national booking system. There's also a link just shared on the slides about how you can get access to that vaccination and exactly who's eligible. Also, the flu programme is underway both within schools and the community, and it has been confirmed that the JCVI have approved the co-administration of the COVID-19 booster and flu vaccine, although delay of availability of either of those vaccines won't impact on the rollout plan. And then finally, the last update is around the number 3 COVID regulations. We've had confirmation that they've been extended till 24th of March 22, which will enable local authorities to retain the powers that we've had during this pandemic to be able to respond to serious and imminent threats to public health. And it also extends and amends the self-isolation regulations in accordance with the updated guidance on self-isolation requirements. And that's it. Thank you.
Brilliant. Thank you for that. And apologies for being a little bit distracted. I just happened to get a text message from my son saying that there's quite a considerable number of people he's at university with have just tested positive, and now they're looking at isolation measures. And questions from anybody? No. Okay. Thank you, Kelly, for a very comprehensive update. That was great. Gabby, hopefully we can get your tech sorted for the next one. But yeah, Kelly, thanks for jumping in there. If no questions, Elena, over to you.
Thank you, Chair. Just bear with me 2 seconds while I share my screen. Can you all see that?
Looks like it's, there we go. Yeah.
Perfect. Okie dokie. So I'll just run through the communications update for this month, and then I'll hand over to Abby Thomas for the engagement update. Happy to take any questions on the comms at the end. So as Kelly was talking about the winter plan, we have aligned our key comms priorities for broadcast communications to that plan for this month and the foreseeable future. So unsurprisingly, you will see that vaccination is one of our top priorities, encouraging uptake and how to get a jab and how to make an appointment, how to drop in. And we're also aligning that information with the boosters and the flu vaccination. As Kelly mentioned earlier, health protection measures are still really important. So we're emphasising that COVID hasn't gone away, that it's not over, and that residents really need to look at how they can keep themselves and their loved ones as safe as possible. So we're still sharing information on hands, face, space, ventilate, isolate, and vaccination. And then finally, on our key priorities, we have testing and self-isolation. So the importance of asymptomatic testing through lateral flow tests, but also getting a PCR test if you are symptomatic or Test and Trace have asked you to take a test, but also complying with anything that Test and Trace ask people to do in terms of isolations or share contacts is really key in stopping the spread. So we're ramping up messages around that. So how are we doing that? You can see on the right-hand side there, we've got some new assets that our COVID graphic designer has created. We have stepped away somewhat from the national asset just because they were becoming a little bit samey across lots of different channels nationally and locally. So we are using more localized images and messages. We'll also start some radio advertising. It will be geo-targeted across digital channels just to Bracknell Forest. So we get those messages out to a very targeted audience. That will happen this month and will roll out across the month as well. And social media advertising, we're looking at extending it from just the usual Facebook, Instagram, Snapchat channels to including YouTube. So using other channels using channels within YouTube that we know residents and specific demographics use, and targeting those messages to those audiences. The other thing that we're just in production of at the moment is a winter wellbeing. It's a health and wellbeing booklet. It will go to all households in October. It's just in final production. The reason we're doing a booklet, a hard copy booklet, is that we understand not everybody is on digital channels. So we need to make sure we get all of those 3 priority messages out to everybody. And the only way to really do that is to send the information through people's doors. In terms of targeted communications, we know that we still need to target the local male population. As I spoke about at the last engagement board, we know that men are slightly slower in coming forward for vaccination. So we have started targeting key messages and key assets to that audience. You can see on the right-hand side some examples of the assets that we've been using, and they're in key locations, for example, cinema advertising. And a lot of our sports and social clubs have been really key in getting those messages out to their players, their audiences, their stakeholders. And some of our local businesses also started sharing those messages. So I'd just like to say thank you to everybody who has been helping us spread that message over the past month, and everybody who will continue to help us to do that. Going forward, we're going to split the campaign into two. So one is around parent power, so encouraging people who have younger males, so the sort of 16 to 20-year-olds who aren't yet jabbed or aren't testing, encouraging parents to encouraging their sons or their grandsons or whoever it is to come forward for testing and vaccination. We'll also target older males by using messages that just show how easy it is to actually come forward for testing and vaccination, just because we know those kind of messages encourage behaviour change, so we can help increase that message reach. That's it for communications at the moment, so I'll just hand over to Abby for engagement.
Thanks, Elena. So in terms of engagement priorities since the last meeting, we've done some work to analyse local demographic data so that we can identify areas with higher percentages of Black, Asian and minority ethnic residences, so that we can target the deployment of the mobile testing unit to some of those areas. And also alongside that, identified wards in the borough with a higher number of different languages spoken and higher numbers of different BAME residents in order to support our targeted communications work. We're also identifying potential venues for targeted community testing, so looking at a wide variety of different community facilities. And alongside that, leading on some engagement work with underserved communities, including the Gypsy Roma traveller community, Polish and some African heritage communities. And we're pleased to say that we've also recruited a new COVID community engagement officer who will be starting on the 18th of October to drive forward and expand some of the engagement work. Thank you. Sure, Elena, I'm happy to take any questions.
That was short and sweet. Thanks for that. Really good to see that new post is coming on board. I think that will that will really help. Any questions around the table? No. Gabby, you've just been able to reconnect properly. Is there anything that you wanted to add to what Kelly had said?
Thank you, Chair. It was just thank you very much, Kelly, for covering for me. That was a fantastic job. I just wanted to highlight on the vaccination slide that will be available after the meeting, that we've made some really good work, and I think it's thanks partly due to Elena and Abby's teams on the communication and engagement. In the 18+ category, last time I reported a month ago, we were on 73%. We're now on 80%, which is over and above the South East average, and last time we were below. Thank you, Chair.
That's great. I think it's a really good call out. Anything else? No? Okay. Thank you for all those updates. Moving on through the agenda guide, I think the only other thing really is the managing by exception, anything that's on the log. I think it's just the standard one that remains on there. No? Okay.
Chair, we've also got public participation as just to advise the board that I'm not aware of any questions that have been submitted to the committee Dropbox in advance of the meeting.
Brilliant, thank you. Yeah, apologies for that. Okay, if there's nothing else,